What I'm about to share could save your kidneys. And here's the shocking truth. To 90% of people with kidney disease have no idea. They have it until they've lost up to 90% of their kidney function. But your body is actually sending you warning signals right now. I'm going to walk you through 17 critical warning signs that medical research has validated as early indicators of kidney problems. Your kidneys filter about 50 gallons of blood every single day, working silently to keep you alive, but they're also incredibly silent when something goes wrong. That's why recognizing these signs early could literally save your life and potentially avoid the need for dialysis or kidney transplant down the road. Let me start with what medical experts consider the most reliable early warning sign that you absolutely cannot ignore. Warning sign number 1 is foamy or frothy urine that looks like beaten egg whites. This isn't just any foam. This occurs when protein is leaking through damaged kidney filters, and unlike other symptoms, this can actually appear in earlier stages of kidney disease. If you're seeing persistent foam in your urine, especially if it doesn't go away after flushing, this is your kidneys crying for help. Please don't ignore this sign. The second warning sign is persistent swelling in your hands, feet, or ankles that doesn't improve with rest or elevation. This signals that your kidneys are losing their ability to regulate fluid balance, causing sodium and water retention. Many people dismiss this as just getting older or standing too long. But Cleveland Clinic research shows this is often the first noticeable symptom patients actually experience. Before I continue, does this information make sense so far? Type YES in the comments if you're following along. And if you want more evidence-based health content like this, please hit that subscribe button, because we're just getting started with information that could change your life. Warning sign number 3 is unexplained fatigue and weakness that doesn't improve even after a good night's sleep. Now, this isn't just being tired after a long day. This fatigue results from multiple mechanisms. Anemia due to reduced hormone production, accumulation of over 100 identified toxic substances in your blood, and metabolic changes affecting your muscle strength. Research shows this affects the majority of patients with advanced kidney disease, but it can start much earlier than most people realize. The fourth sign is changes in your urination patterns. You might notice you're urinating much more frequently, especially at night. We call this nocturia, or the complete opposite, where you're barely urinating at all. The color might be darker than usual. You might see blood, which is definitely a red flag that needs immediate medical attention. Or your urine might have a strong, unusual odor. Warning sign 5 is persistent nausea or vomiting without any obvious cause, like food poisoning or the flu. As waste products build up in your blood that should normally be filtered by your kidneys, they can make you feel sick to your stomach. This is often dismissed as stress or dietary issues, but it could be a sign that toxins are accumulating in your system. The 6th warning sign is a metallic taste in your mouth or persistent bad breath that doesn't go away with brushing, mouthwash, or dental care. Research shows this affects approximately 35% of patients with end-stage renal disease. Due to urea breakdown in saliva and toxin effects on taste receptors, if you're experiencing this consistently, it's worth investigating further. Sign number 7 is muscle cramps, particularly at night or during light activity. Your kidneys help balance crucial electrolytes like potassium, calcium, and phosphorus. When this balance is disrupted, you might experience painful cramps that seem to come from nowhere. Don't respond well to typical treatments like stretching or hydration. Who else has experienced unexplained muscle cramps? Share your experience in the comments below, because I want to know how common this is in our health treatment center community. We typically see hundreds of people share their experiences when we discuss this symptom. Warning sign 8 is itchy skin that no moisturizer seems to help. This eremic itching is linked to toxin buildup and affects the skin in ways that topical treatments can't address. Many people spend hundreds of dollars on skincare products, when the real issue might be kidney function. Itching is often worse on your back, arms, and legs. The 9th sign is high blood pressure that's difficult to control, even with medication. New onset or worsening hypertension often represents an early manifestation of kidney disease, present in 80 to 85% of kidney disease patients. Your kidneys play a crucial role in regulating blood pressure, so kidney disease and hypertension often go hand in hand. Sign number 10 is difficulty concentrating, brain fog, or memory problems. Subtle cognitive changes can appear as early as stage 3 kidney disease, affecting neural transmission through electrolyte imbalances and inflammatory substances crossing into your brain. When toxins aren't being properly filtered, they can affect your mental clarity, making it hard to focus at work or remember simple things. Warning sign 11 is shortness of breath, especially when lying down or during light activities that never used to bother you. This can result from fluid retention in your lungs combined with anemia, making you feel like you can't catch your breath. This is particularly concerning if you don't have a history of heart or lung problems. The 12th sign is loss of appetite or food tasting different than usual. Even your favorite foods. Uremic toxins can alter your sense of taste and make even familiar foods seem unappetizing. This often leads to unintentional weight loss, which compounds the problem by reducing your body's ability to fight the disease. If you found this information valuable so far, please hit that like button because it really helps us reach more people who need this potentially life-saving information. In the comments below, tell me which of these signs has surprised you the most. I read every comment, and your feedback helps us create content that truly serves our community. Sign 13 is sleep disturbances, including restless leg syndrome, or just trouble getting comfortable at night. Research shows sleep disorders affect 36 to 59% of patients with stages 3 to 4 kidney disease. The buildup of waste products can cause uncomfortable sensations in your legs that make it impossible to get quality rest, which then affects your overall health and recovery. Warning sign 14 is bone pain or weakness, especially in your back, hips, or legs. Your kidneys help regulate calcium and phosphorus metabolism. When they're not working properly, your bones can become weak and painful as these crucial minerals become imbalanced. This can lead to increased fracture risk and chronic pain. The 15th sign is frequent infections or getting sick more often than usual. Your kidneys help maintain your immune system, so kidney problems can leave you more vulnerable to infections. If you're constantly fighting colds, urinary tract infections, or other illnesses that seem to take forever to clear up, this could be a contributing factor. Sign 16 is feeling cold all the time, even in warm weather, especially in your hands and feet. This chronic coldness is related to anemia from kidney disease, which affects your blood's ability to carry oxygen and regulate temperature. You might find yourself layering up when others are comfortable or always needing blankets. The final warning sign, number 17, is persistent hiccups that seem to come from nowhere and last longer than normal hiccups should. While this might sound strange, chronic hiccups can actually be a sign of kidney problems, especially when they occur frequently without an obvious trigger like eating too fast or drinking carbonated beverages. This happens due to toxin buildup affecting your diaphragm and nervous system. Now, here's what you need to understand about these warning signs. The fundamental challenge is that there's often a significant time lag between when your kidneys start having problems and when symptoms appear, sometimes 2 to 5 years. This is why regular testing is so crucial, especially if you have risk factors like diabetes, high blood pressure, heart disease, or a family history of kidney problems. Current medical research shows that 35.5 million Americans have chronic kidney disease. That's 14% of all adults. But approximately 1 in 3 adults with severe kidney disease are completely unaware of their condition. The statistics are even more concerning for people with diabetes, where 50% to 94% of type 2 diabetes patients with kidney disease remain undiagnosed. If you're recognizing several of these warning signs, please don't panic, but definitely don't ignore them either. The key is early detection and working with your healthcare team. Here at Health Treatment Center, we've helped thousands of people understand their kidney health better through proper testing and evidence-based lifestyle modifications. The good news is that early intervention can dramatically improve outcomes and reduce progression. Recent clinical trials show up to 28% reduction in kidney disease progression when detected early and treatment is initiated promptly. Your kidneys are incredibly resilient organs, but they need your attention and care. Comment ready below if you're going to take action and discuss these symptoms with your healthcare provider. And if you know someone who needs to see this information, please share this video with them because early detection could literally save their life. The most important thing to remember is that these warning signs are your body's way of asking for help. While the average decline in kidney function is about 1 milliliter per minute per year after age 40, early intervention can slow this progression significantly. Don't wait until symptoms become severe. If you're experiencing multiple warning signs, schedule an appointment with your healthcare provider and specifically ask about kidney function testing, including blood work and urine analysis. Remember, laboratory-based screening is far more reliable than symptom recognition for early detection. Your doctor can run simple tests like estimated glomerular filtration rate and urine, albumin to creatinine ratio that can detect problems years before symptoms appear. What was your biggest takeaway from these 17 warning signs? Share it in the comments below. Subscribe for more science-backed health content that could save your life. And remember that your health is your greatest asset. Until next time, this is your team at Health Treatment Center reminding you that early detection and prevention are always better than waiting for a crisis. Take care of your kidneys, and they'll take care of you.